Hello, my name is Virginia Velez Quinones. I'm currently a PGY2 at University of Miami, ACA JFK Medical Center. We present a case titled From Nephrons to Neurons, a case of Listeria, meningoencephalitis, and septicemia as a complication of rituximab therapy for glomerulonephritis. So, as an introduction, monoclonal antibodies and its initial types of immunotherapy really change anti-cancer treatment. Rituximab, which is the chimeric monoantibody, which binds to CD20, was the first therapeutic antibody approved for oncology patients. However, multiple trials and post-marketing surveillance has associated increased numbers of adverse effects with this medication, and sometimes they can develop invasive infections, some of them requiring ICU treatment, but the estimated risk with rituximab is estimated to be about 1%. We report a case of a patient that developed meningoencephalitis and septicemia caused by Listeria monocytogenes by taking rituximab for glomerulonephritis. This was a 65-year-old female, history of chronic kidney disease stage 3B, came in with fever and altered mental status. On admission, she was found to have mild leukocytosis, and on physical exam, she was found lethargic. Initial CT brain didn't show any acute abnormalities, and blood cultures were negative. She was started on empiric antibiotics, and upon further questioning of family members, it was found that the patient had a renal biopsy showing ANCA-positive vasculitis with low complement and fibrociliary crescents, indicative of crescentic glomerulonephritis. It was also later noted that the patient was on outpatient rituximab for the treatment of glomerulonephritis. Now, during the hospitalization, this patient developed seizures. Repeat CT brain was ordered and did not show any acute intracranial process. So after this, the MRI of the brain was ordered, and it showed restricted effusion in the periventricular white matter of the bilateral lateral ventricles and severe periventricular white matter T2 hyperintensity, which was suggestive of infectious or inflammatory process. CSF analysis revealed white blood cells, elevated protein, and normal glucose. CSF viral PCR was negative, but then repeat blood cultures revealed Listeria monocytogenes. The patient was treated for Listeria, meningoencephalitis, and septicemia. So of note, Listeria is a gram-positive facultative intracellular bacterium. It's sometimes acquired by ingestion of contaminated milk, raw meats, and fish. Now, Listeria really affects healthy individuals, but can lead to disseminated disease in immunocompromised patients. Now, reports of invasive listeriosis associated with rituximab are rare. Usually reported infections with Listeria in immunocompromised are abscesses, especially in the brain, liver or spleen, and central nervous system infections. But our patient presented with this invasive listeriosis as a complication of rituximab treatment. And I mentioned before that disseminated disease reported with rituximab therapy is estimated to be about 1%. So I think this case suggests that we should be aware of adverse effects and complications of the use of rituximab that can sometimes be potentially fatal and not easily recognized. And I think it's something we should be aware of and requires further research.